The final proponent is Jonathan Butcher from Heritage Action for America. Jonathan, are
Yes,
you?
Chair Erickson, can you
Yes,
hear
you
me?
have three. Yes, thank you. You have 3 minutes.
Thank you. Chair Erickson and members of the committee, thank you for the opportunity to provide proponent testimony in support of this proposal on behalf of Heritage Action for America. My name is Jonathan Butcher, and I'm the Will Skillman Senior Research Fellow in Education at the Heritage Foundation. Educators have a responsibility to inform parents about their child's health while at school. Parents are a child's primary caregivers, a role confirmed by the U.S. Supreme Court in Wisconsin v. Yoder, among others, which stated that the primary role of the parents in the upbringing of their children is established beyond debate as an enduring American tradition. Yet, according to Parents Defending Education, more than 1,100 school districts across the U.S., including some 20,951 schools that enroll some 12.2 million students, they have policies that either prohibit or make optional the communication between educators and parents about a child's health, specifically cases in which a child shows confusion about their sex. In Kansas, Topeka, Kansas City, and Wichita public schools are listed among these districts. Yet K-12 students are largely minor-age children, and the Supreme Court has said that most children, quote, simply are not able to make sound judgments concerning many decisions, including their need for medical care or treatment. Unfortunately, for many years, some medical professionals and even policymakers promoted a, quote, affirming model of care that accepted a young child's own diagnosis without questioning whether pursuing hormonal or other physical changes were in that child's best interest. This affirmation often precedes medical interventions, such as the off-label use of hormone treatments and medicines that block puberty. Social affirmation that leads young people through a sequence of decisions that can culminate in surgical interventions, like hormone treatments, have irreversible consequences and often damaging results. Medical interventions and examples of social affirmation are in fact taking place in K-12 schools around the U.S. When a child attends school and says he or she was born in the wrong body, this is a health-related issue, even a sign of emotional or mental distress. For these reasons, it is essential for school personnel to include parents in discussions about a child's health. Very quickly, research has found that so-called gender affirmations do not improve the mental health of patients confused about their sex. In 2024, England's National Health Service released what is known as the CAS report, which reviewed research evidence on, quote, transgender procedures. Among the key findings are that, first, children can be confused about their sex, but in general, we should not be surprised if a young person's, quote, sense of identity is not always fixed and may evolve over time. In fact, research has found that in 60 to 90% of cases of children confused about their sex, this confusion resolves naturally without interventions as the children complete puberty and enter adulthood. The evidence on how to treat someone who's confused about their sex is, quote, weak, and, quote, clinicians say that they are unable to determine with any certainty which children and young people will go on to have an enduring trans identity. We do not know what, quote, gender medicine is going to do to young people. Quote, our current understanding of the long-term health impacts of hormone interventions is limited and needs to be better understood, the CAS authors wrote. Research from my Heritage Foundation.
Mr. Butcher,
yes, ma'am.
I'm so sorry, your time is up. Would you be available to stand for questions?
Be glad to, and also to provide my testimony written. Thank you.